Fine, sir. Welcome, sir. So, generally speaking, what determines your coverage in health insurance practice is your own plan. That's what we call health insurance plan. Now, health insurance enrollees, okay, are placed or classified under various plans. Now, what determines your plan to a large extent is your position in your office and the salary you take, the amount you take as salary. So if you are a senior staff in your organization, for instance, and your salary is maybe huge or reasonable to an extent, so that should mean that because of your position as a senior staff and the fact that your salary is fat, maybe you earn like up to 800,000 or 1 million naira a month. Now your employer, okay, should be able to take maybe like 10,000 naira monthly, okay, to pay for your health insurance premiums. Because your employer is paying money, what we call premium. The employer pays premium to your HMO every month, okay, to service your health insurance coverage. To service your health insurance coverage. Are you following? So if you are a senior staff, because you earn well, in quote, you earn well, and your company is taking much from your salary to service payment of premiums for you. So your company will now place you on a higher plan, maybe gold, okay, gold plan or platinum, which happens to be the highest one, the highest plan. So if your plan is high, it follows that what you're also paying to service that plan is also what? It's also high in terms of money. So when you now come to the hospital, you want to access care, your coverage should be what? Should be higher too. So if it now comes to the question, we now want to answer the question you asked, like
surgeries.
Yeah, surgeries. Specifically, you mentioned myomectomy. That's surgery for fibroid.
Yeah.
So your HMO will definitely or should definitely cover for you if your plan is high. So they will cover to the extent that they too will not lose. Because from what your company is paying to them, they are also making profit. Yes. But if you are a junior staff in your organization, okay, who earns, maybe your salary is not much, and for instance your company is taking like maybe 2,000 naira monthly to service your health insurance, that would translate into 24,000. That's 2,000 times 12 months in a year. That's like 24,000 naira. So you may be on basic plan, which is the lowest plan. So if that is the case, such an enrollee will definitely not be covered for a major surgery like myomectomy. Are you following? So, but again, for individuals on higher plans too, like I've said earlier, if you're on gold plan or platinum plan, even if your HMO will not offer you 100% what coverage, there's what we call limit. So they will not say, okay, fine, if this surgery is 500,000, based on your limit for surgery, the HMO will say we are going to cover 350,000. What's the difference? 150. So the enrollee, in this case you now, will be required to what? To pay the difference. So thank you. Do you have any question?
Okay. I think this is my HMO.
I will be with you shortly.
They pay about I think about 200k. They pay about 200k months. Annually, yes.
For you?
Yes.
And your family? Is it only you?
It's supposed to be me and my family. But
Okay.
since I'm single, I'm the
For
only
now,
one
it's
using
only
it.
you.
Yes,
Okay.
I'm the only one using it. Do you think it will cover it?
200,000 naira
Annually.
per annum. Of course, they might cover, but again, how do we determine coverage? We HMO consultants, what we do is at every point in time you want to undergo maybe a major procedure, maybe surgery or any other major procedure, it is our responsibility to get across, to inform your HMO that you are to what? You are to do this surgery. So it is the HMO that will now take decision and say, okay, fine, we are covering 100%, we are covering to this extent. You know, earlier I mentioned limit. So if you now say this is your limit, this is how much we are going to pay, the enrollee will not decide rather whether he or she wants to what? To pay the difference. But whether you are paying 200,000, what your company is paying, like you said, is 200,000 to service your health insurance, fine. If you now look at it very critically, if the HMO wants to cover a major surgery like myomectomy, that's surgery for removal of fibroids, they may not cover it. They may not cover it. They may not cover it. They may not cover it based on that 200,000, because 200,000 may actually not be enough to take care of fibroid surgery. But the way health insurance works is that it's a pool. We call it a pool. Pool means that it's not only you that is registered under that health insurance arrangement. You may have like thousands of persons, maybe across Nigeria, depending on the country you find yourself. So the assumption is that, the thinking is that all of you that are subscribed to the health insurance system should not fall ill at the same time. Are you following? So if you fall ill, you need to access health care. Your health insurance company will maybe take what others are paying. Okay, from what others are paying, like I said, it is a pool, like a basket. They will take from the entire money, the total money in that basket, to pay for you. Because like I said, everybody should not take treatment, should not fall ill, and should not take treatment at the same time. Okay, so they will not take from maybe the money meant for others. Some persons do not really frequent hospitals. So it's like their own money is lying fallow. They take from them. So it is not like a cooperative stuff for those of us that are cooperative. So it favors you today, another day it favors
For example,
another person.
now, this my HMO covers hepatitis B vaccine.
Okay, have you taken that vaccine?
They refuse to give me.
Okay.
They are saying I'm requesting. Should they are supposed to assist me?
If you request, health insurance generally does not cover anything on request. But if there is a diagnosis, okay, and the doctor wants you to take that vaccine based on the diagnosis, then a message will be sent to your HMO. If your HMO approves, the hospital will administer
The
it.
doctor needs to help me now.
Like I said, if there is a diagnosis,
Know that thing is transferable. So I don't need to have the symptoms now. Before I take the vaccine,
if there is,
I want to use
if
the
there,
opportunity to get the vaccine done.
it's okay. When we get there, we'll look at it. So thank you.
Responded.
Thank you for your time, and thank you for watching my video. You can buy my book, Practical Working of the Health Insurance System. I'm the author of this book. You can go to Amazon and search Practical Working of the Health Insurance System, authored by Osimi Chukwuka Frank. You can either search my name, Osimi Chukwuka Frank, or you search the name of the book on Amazon. Thank you very much.